I think you have a tremendous opportunity to use the data to help you improve if you understand how to think about the data clearly. We have 40 years of experience looking at variations in healthcare. And we distinguish three very different kinds of variation. There are certain services that we know every patient with a particular clinical problem should receive. You're hospitalized with a heart attack, you want to have an angioplasty within an hour of getting to the hospital. We refer to that in the United States as effective care, and we see tremendous failures. We are unable to deliver, even when we know what the right thing to do is, we are often unable to deliver the right thing reliably and effectively. That is where the science of improvement is so important, and which I've seen well delivered here in Sweden. The second category of variation is more problematic. These are services such as hip replacement or such as elective procedures for angina, chest pain of the heart, when you have a blockage of one of the vessels, where patient preferences about the outcomes are very important. For example, when you're undergoing a stent for coronary artery disease in an elective situation, most patients in America or elsewhere believe that that procedure will reduce their risks of a heart attack. It will not. It does make their chest pain get a little better, a little more quickly. So the question in that particular case, which we refer to as preference-sensitive care, is to understand what are the patient's preferences. Would they prefer to have their chest pain relieved more quickly, or would they prefer to take the medications, have no increased risk of heart attack, but be able to avoid the blood thinners that you have to take after having the elective procedure? The third category of care we have studied deeply in the United States, and that is what we refer to as supply-sensitive care. These are services which doctors prescribe because they want to. It's things like a hospital stay. It's how often should you see your physician for a visit. They are the most expensive decisions we make in healthcare. If you say when the patient leaves the office, I should see you in a month, or I should see you in 2 months, the cost of that decision doubles the cost of healthcare if you reduce the interval by 50%. So those insights, we believe, will be very helpful to you as you think about how to take advantage of the wonderful information in open comparisons, how to take advantage of the incredible information in the quality registers and say, how can we improve care so that we do the right thing right, so that we do the right thing for the right patient, and how we can waste no money. The key is to interpret the information wisely. I think a big mistake that we have made in U.S. healthcare and in healthcare systems around the world is to assume that because physicians are trained in science, that we can trust the profession of medicine to make scientific decisions that will result in excellent care for every individual and for populations. Patients can take care of themselves. I had a spectacular visit to the renal dialysis unit at Jönköping, where I saw how 60% of the patients are taking care of themselves in a very technically difficult field, which is renal hemodialysis. And if we can teach patients to do hemodialysis, how many other things can we teach them to do which will allow us to need fewer physicians in the future when our population ages, and have that care delivered by nurses, by patients themselves. We also do know that a built bed is a filled bed. Goes back to Romer's Law from the 1950s in the United States. And under bureaucratic systems, just as in fee-for-service systems in the United States, if you fail to keep your beds full, you will have to close your beds. Your budget will go down. So the same incentives, the same professional incentives are operating on hospital managers in planned economies and hospital managers in market economies.
So then we could maybe gradually decrease the spending on health services for better use in other sectors.
Or let people have it and keep it in their pockets.